This is a CNN News 18 exclusive. This is about the worsening economic crisis and the devaluation of currency, which is hitting Pakistan hard. Now, the healthcare system and Pakistan hospitals and medical stores are reportedly running out of life-saving drugs. Hypertension, insulin, Disprin, paracetamol, and other medications for these ailments are short in markets. The healthcare system in Pakistan is on the verge of collapse. Medics are being forced to not perform surgeries due to the shortage of these important life-saving drugs. And beyond the lack of life-saving drugs and their availability, there's also a shortage of medical equipment which is necessary, and that's leading to doctors not being able to perform surgeries which are necessary. Now, there are 5,000 plus LCs for medical raw material, and those are pending in the Pakistan Central Bank. And the statement that has been made is that they don't have drugs or the raw material. How can we produce the medicines? We're crossing over to CNN News 18's Foreign Affairs correspondent Abhishek Jha for more on this. Abhishek, tell us more about the lack of life-saving medication and medical equipment.
Asha, as you told only that Pakistan's overall healthcare system and the pharmaceutical system is much more import-driven. So when the Pakistani government doesn't have enough cash to have ability to import essential commodities and drugs and the raw materials that can actually is required to manufacture other drugs that can be locally produced as well, then obviously they are going to prioritize which sector they want to let the money flow. And probably this healthcare system is also being hit hard because of the forex cash-strapped economy that Pakistan is currently dealing with, and that has created several life-saving drugs, equipments, surgery equipments, and OT operation theater equipment, and vital medical equipment are not being made available to the healthcare system in Pakistan, be it in government hospitals or in private sector hospitals, because of the crisis that overall economic crisis that Pakistan is currently dealing with. We have seen this crisis reflecting in food inflation, higher gas prices, higher electricity prices, and economic area. But this is the latest and very vital part of Pakistani people's day-to-day life, which is now being impacted by the economic crisis that Pakistan is every day dealing right now.
Absolutely. Now, this is jolt after jolt for Pakistan. What exactly is being done to give a remedy to this situation? Because not having life-saving drugs, that's a very, very big jolt to Pakistan.
So, in fact, Pakistan has been asking and sort of pleading with its neighbors and allies who can come forward and help Pakistan, which have been a precedent. Like Pakistan has been much more dependent on China. Some of its Gulf compatriots like Saudi and UAE, they have in past, rolled out billions of dollars for the Pakistani government to keep a substantial cash reserve in Pakistani bank accounts. But probably this is the brim that Pakistan has reached, and no money supply or no support and aid and assistance is coming to aid Pakistan in this hour of crisis. In fact, the monetary institution, International Monetary Finance Fund institutions, and other World Bank institutions, they are also not coming forward because the kind of conditions that they have put to Pakistani government in order to get more funds and more assistance, the government in Pakistan is not being able to meet those requirements. Especially, they have asked Pakistani government to cut on the higher defense budget by 10 to 20%, which Pakistan government has not been able to come to terms with. There are other decrease in subsidies also, where Pakistani government is also not being able to make a very strong decision because of the political compulsions that they are currently dealing in Pakistan. So clearly, these are the very complex situation and the web in which Pakistani economy is rolling into, and we'll have to see from here onwards how worse only the situation is going to get in the months to come.
Absolutely. All right, Abhishek, thank you so much for joining us and for bringing us those details.